Is Mizoram bracing for a more worse COVID situation? Such are the apprehension after 528 new cases were detected, and that too from a rehabilitation center. Well, this is the highest number of cases detected in a single day in the state since the outbreak of the pandemic last year. Triggering fresh concerns, the new cases were detected at the Thutak Nunpuitu Team, an orphanage home and rehabilitation center located in the outskirts of capital Aizawl. 989 samples were tested out of the total 1,500 residents in the facility, out of which 500 have tested positive. Meanwhile, it is likely that more new cases might be detected as testing of the remaining 511 individuals are still underway. The results are expected to be out by this evening, and meanwhile, the facility has been declared as a containment zone and steps are being taken to convert the TNT into a COVID care center. It may be mentioned that the first case came to light after one of the caretakers tested positive. Meanwhile, one of the residents in the facility who also went for testing tested negative. And after the required contact tracing was done, the test samples of all the primary and secondary contacts of the caretaker showed negative results, and the officials at TNT felt that there was nothing to be worried about. However, things took an early turn after it was found out that residents who have finished the rehabilitation course at the center, when tested as per protocol, were all tested positive upon reaching their own homes. And in an exclusive conversation with Northeast Live Editor-in-Chief Wasbir Hussain, Mizoram Chief Minister Zoramthanga said he is personally monitoring the situation after the detection of whopping 528 cases in the Orphanage and Rehabilitation Centre. Let's listen into the conversation.
I am now joined by Mr. Zoramthanga, the Chief Minister of Mizoram. Zoramthanga, welcome to Northeast Live. Mr. Chief Minister, the COVID situation in Mizoram has taken a drastic turn after 528 inmates of the TNT orphanage in the heart of Aizawl tested positive yesterday. Have you asked for any special investigation?
Together with our medical team, yesterday they have taken up the matter, and now on the spot verification and what is required and what next steps are to be done. They're all looked after by the under the leadership of the medical operation team. And now together, since it is my constituency also, I tried my level best with my party men, with the officials, and with the health department. And I believe that we shall be able to manage it soon.
Now you see, the orphanage has apparently 1,500 inmates, and only 989 of them were tested. Has the remaining been tested already, and if so, have more inmates been found COVID positive?
You see, all of them were not in the same place all along, because they have many branches in other towns also. So some of them, they went to their parents regarding this period, and now who are at the present, they are slightly less than 1,000, round about 1,000, let us say. So all the available persons who were there, they were there and they were tested. And the reason why this sudden upsurge is that, as you know, they are the orphanage. Some areas, some are slightly below normal and who are very difficult to manage in this matter. So all of a sudden, because it may be this Delta variant, and increase may suddenly come up. But anyhow, we as soon as we learn that there is some surge of COVID epidemic here, so we sent our special team, and then they tested it, and half or more than half of them have found positive, but not a very serious one, but almost all of them were not that serious. Some were symptomatic, some were not symptomatic. Therefore, they at present, the condition seems to be not so serious.
Now, is it a private or government-run orphanage? Prima facie, it appears that the orphanage authorities could have been a little more careful as there were so many inmates.
Well, here there are different kinds of homes. It is a private, but all registered under the government. It is registered, and so there are other homes also. And then the authorities from the government who are looking after this, they check and we help them in other homes and here in the orphanage also. But you know, when there is some more inmates there, and when they themselves do not report as it should be, then all of a sudden we learn that there is an increase. In other homes, we have been checking there also. That is why it is a private, but well and looked after by the government to a very great extent.
Now, Zoramthanga, generally in the state, what will be the state government strategy now to contain the overall COVID situation in Mizoram state?
You see, we are trying our level best, and the lockdown has been going on for quite a long time. People are very, I should say, that cooperative, disciplined, and I believe that here in the Northeast and in other states of India, the people of Mizoram are the most cooperative as far as this lockdown SOPs are concerned. That is why up till now, the mortality rate, the death rate in all the states of India, Mizoram is the lowest. But nevertheless, since the upsurge is coming, maybe of a Delta variant, that is why we have faced the same problem. But now there is that we're tracing it, and we're trying our best, and it's slightly declining now. But only this orphanage is of a sudden invention, and I believe that these also, they have a big compound in themselves. We are going to convert it into the community care center, and government is going to help them, look after them, and at the same time, you see, here the people of Mizoram are such that in many containment areas, when there's a problem, villagers collected their vegetables and send truckloads and truckloads to the containment area, provided they will have a problem. I believe that the same thing will happen there in this TNT orphanage also.
Right.
And rice and other vegetables and other requirements, it will not be a problem.